Hello, my name is Dr. Tiffany Baffour, and I'm Director of the Master of Social Work program here at the University of Utah. The program identifies one area of specialized practice. Advanced generalist practice has been identified as the fastest growing area of specialization for Master of Social Work programs in the United States. Thus, the program seeks to reflect the nationwide movement for social work education to prepare social workers to address complex issues through multi-method, multi-level, and theoretically grounded perspectives, and to work effectively with diverse groups at all system levels, including individuals, families, groups, organizations, and communities. An advanced generalist preparation is the ideal preparation for responding to complex problems, diverse populations, and clients' needs for a wide range of services. Given the rural nature of much of the state of Utah, as well as our neighboring states, social workers must have enhanced technical abilities and sophisticated direct and indirect skills. Our program aptly prepares students for the challenges facing social workers in both urban and rural communities. Furthermore, these skills are applicable across practice settings. Graduates may work with multiple systems and use administrative, community development, as well as important clinical skills with a wide range of populations. During advanced coursework, typically taken during a one-year program for advanced standing BSW students, the second year of the two-year program for two-year students, and introduced in the second year of a three-year part-time program. Students have the ability to complete an area of focus. Students complete advanced practice classes as well as field practicum in an area of focus, including aging, child welfare, forensics, global, health, mental health, and substance use in social work. Continue watching to learn more about each area offered by the MSW program. You can also contact Academic Advising for more information. Thank you.
Hi, I'm Charlie Hoy-Ellis. I'm Assistant Professor here at the College of Social Work, and I am also the co-chair of the Aging Area Focus in our MSW program.
Chad McDonald, Research Assistant Professor here at the College of Social Work, working at SRI, but I'm also the Child Welfare Chair.
My name is Christian Sarver, and I'm the Associate Director of the Utah Criminal Justice Center.
I'm Cetrola Sanchez, and I'm an Assistant Professor here at the School of Social Work and the Chair of the Global Areas of Focus.
So I'm Troy Andersen. I've been on faculty here at the College of Social Work for about 10 years. I've been working in the health concentration since that time and currently am the concentration chair.
As far as I can tell, I'm still David Derezotes, and I am the chair of the mental health group in the second year.
I'm Jerry Buie. I'm a clinical social worker, and I chair the substance use in social work concentration.
In my advanced practicum, I was at Seattle Counseling Service for Sexual Minorities. I was interested in working with LGBTQ populations, and during the years, they hired me after I got my MSW, and during the years I was there, I began to see how LGBTQ people were experiencing ageism within the community that they had first been embraced by. And so the intersection of being LGBTQ and being older kind of set the framework. And then as I went into my PhD studies, I began to learn, get a lot more interested in aging itself, as well as sexual orientations and gender identities and expressions.
So I've always been interested in things that help families become healthier and better off, increase their well-being. I started in psychology, thinking that was really a good place to target. For me, I realized it wasn't. We moved on to marriage counseling, moved on to marriage, family, and human development, then added an emphasis in family finance, and which led me to the child welfare system. I realized that, at least here in Utah, the child welfare system or the agency that the public agency here that is the government appointed agency over the child welfare client base are the only human service agency in the state whose model is sufficient to address the needs of the entire family system. When you think of all other human service agencies, they have their individual client that they can serve who qualifies for services, if you will, be it DSBD or APS or any of the others, juvenile justice even. But they struggle helping the entire family where additional needs might be required in order to stabilize them, whereas DCFS, their model is designed to address the entire needs of the family system.
So I started my social work career working in victim services. I worked in a couple different domestic violence sexual assault programs, and I think honestly I just got to a point where I continued to see more and more victims, and I thought there's got to be a way to kind of come at this from another angle and try to prevent there being more victims. So my interest in forensic social work is very much kind of how do you reduce recidivism and reduce the rate at which people engage in crime.
Well, I guess I am global. I am an immigrant, and before I came to the United States, I was actually a person of my country. When I came to the United States, I became a person of Latin America. So all of a sudden, I was from 20 countries. I was as Colombian as I was Venezuelan, as I was Argentine, as I was Mexican. And I realized that what we had in common was our immigrant status. And it made us actually, as immigrants, a group of people that had really a lot of commonalities. So I got interested in working with immigrants because of my personal experience and with refugees. And that work led to experience, which led me to teach the class of Global Practice 2, which is practice with immigrants and refugee communities. And that's kind of how I got started.
So I've always been interested in medicine and health. I actually considered going to medical school when I was, younger. But once I started studying psychology and mental health, and it became just such an incredible fascination. But so I've kind of kept that interest in the healthcare settings. I'm very interested in the brain and how the brain works. Has been kind of the reason I started in social work in the beginning. I was just kind of figuring out how and why and when does it work and not work. And so I've worked throughout my career in a variety of different healthcare settings, including working in an emergency room setting. I spent over a decade working in an outpatient neurology clinic where we focused on individuals with Alzheimer's disease and related dementias. And I've worked in other hospital-based settings as well. So it's just been an ongoing fascination. My work in the ER has been a mix of working with not only mental health related issues, but also health issues. I've worked on the trauma team, so we deal with sudden death and traumatic death and working with families in that situation. And so just had a really nice mix of different health related positions over the 30 years of practice.
I grew up in the south side of Chicago, and my family migrated to the suburbs when black folk moved in, and that also had an impact on me, because I really liked the neighborhood I was in and the friends I had, and then all of a sudden we were moving, and even back when I was 6 I knew that it was about fear, and it seemed weird to me.
So as a social worker in Salt Lake City, I've worked in lots of different areas of focus, whether it was child welfare or private practice, family services, and what became very apparent quickly in my career is how big the issues of substance abuse are in our society. And we're currently facing an opioid addiction crisis in this country. Prior to that, methamphetamine was huge. And so as a professional in Salt Lake City, it became relevant, critical to understand the issues of addiction and to know what those dynamics are and how to treat them effectively.
So we train our students who have entered into the aging area of focus. We do a significant amount of training around doing screenings, assessments, interventions, and so for the older adult population. This, in addition to like the typical mental health assessments, things like that, we also assessed for risk of falling, social support, things like that. Most of the classes are second year, so fall of the second year, students will take Aging Practice 1, and then in the spring they'll take Aging Practice 2. So Aging Practice 1 focuses more on gerontology, and gerontology is the study of aging, but through a social, cultural lens. So it's the experience of aging. And then Aging Practice 2 is more focused on geriatrics, and so geriatrics is the biological and the physiological aspects of aging. So in Aging Practice 1 we learn everything about aging as a system of oppression, but also all the cool things that social workers get to do, the changes they get to make. We bring a lot of social justice lenses into it. I think one of the very first things that we do in that class is we kind of deconstruct the myth that aging is depressing. Actually, what huge amounts of research shows is that we're at our most depressed right around the age of 50. And after the age of 50, we actually start feeling a whole lot better about ourselves and about our world. And between the ages of 65 and 80, we're probably about the happiest we've ever been. And then the Aging Practice 2 focuses more chronic physical diseases, goes a little bit deeper into mental health issues, dementias, things like that. There's also, we have what's called an interprofessional educational experience. So we partner with the College of Nursing and the other health sciences. And so like this, for example, this coming spring, they'll be doing 6 or 7 simulations. So they have this really fancy simulation laboratory, and they'll work as part of a team with other students in the other health sciences. So there'll be, quote, a client who comes in presenting with particular issues, and it's kind of like a client comes in, presents, and they kind of freeze frame and discuss among themselves what they think is going on, what their next step should be, and then they click play again. And so that's like a 2-hour scenario, and there's I think there's 7 different scenarios, and each one is offered twice. So it's really exciting. We also have what's called many of our students were once on a hotspotting team, and so we know that a lot of the medical care that's provided, there are a few people who, we might call them outliers, so to speak. So they have multiple chronic conditions, probably multiple social conditions. So they're the people that frequently show up over and over in the ER or someplace like that. So students in teams will be assigned to one of these individuals and follow them for a year, trying to figure out how the systems are failing the client. We like to blame clients, we like to blame individuals, but this is typically, if there's a one-size-fits-all, that's great if you're that size. But if you're not that size and you fall through the cracks, it's not your fault. And so we try to do something about that.
The child welfare area focus, there's 2 courses. I don't want to get off track here, but what they would learn in this area focus is the state of the state as it relates to child welfare trends, as well as how we compare to national trends, and then what Utah is doing in order to help address the needs of those that find themselves involved in the child welfare system here. But then beyond that, they would begin to understand the policies that impact the practice that they're being asked to do every day with these families, and other macro level influences, while then also increasing their skill in identifying what interventions are most likely to help the families achieve the positive outcomes that they've all agreed upon. Evidence-based interventions that are proven to work with families are a huge focus of the child welfare system. The first course is more of a macro type course, and it focuses on a national and state level, focus on all the data that and policies that are driving child welfare practice in general today, and helps them develop a skill to critically analyze maybe where the policy, what was the background, how it came to be, what was it supposed to address, did it effectively address the issue for which the policy was enacted, and how does it look when carrying out the interpreting that policy into practice, and whether or not that's been effective. And so it helps them really get a good sense for all the big key players and stakeholders, and the intended and sometimes unintended consequences of these policies. And then 6302 moves it down. It's kind of a big funnel. 6301, 6302 gets more specific in terms of increasing the student's skill on connecting the needs of the family to an evidence-based intervention that's most likely to help them see positive outcomes. And so most of 6302 is spent having the students take a specific population with a specific problem and identify an evidence-based intervention that best fits that population with that problem.
So in the forensic domain, you would be working in correctional settings. That could be a community-based mental health center, working with clients who have been mandated to treatment as the result of a court case. You might also be in prisons or jails. You might work for a legal defender's office as a social worker who's helping people pre-trial, kind of sort things out that have kind of gotten their life maybe a little bit off the rails. You also would potentially work in victim services agencies as well, so that would maybe be a domestic violence shelter, or a prosecutor-based victim advocacy person who helps someone who's been a victim of crime kind of get through the court process and make sure that their voice is heard and that they're getting the services they need. You would also take the 2 practice courses in the forensic domain. And the first one focuses more on the theory of human behavior, criminal behavior, and micro-practice, and then the second course focuses more on agency, organizational work, policy, and research. With forensic social work, there is a lot of research around what interventions are evidence-based and how organizations need to be structured in order to reduce recidivism. And often what happens is you're working, say, in a community mental health center, working with substance abusing clients who have are mandated to treatment because of a court case. And so there's a lot of research that says you need to be evidence-based, not just in terms of how you respond to the substance abuse disorder, but also what's driving the criminal behavior. So you would spend a lot of time learning about how you target not just the alcohol or drug abuse, but also the criminal behavior.
Students in the global area of focus learn about globalization, concepts like globalization. They learn about concepts like social development. The purpose of the concentration, or the main thing, or the areas of focus, or the main thing of the areas of focus is to prepare students for practice in a global context, and also for practice with immigrants and refugees in the United States, so with a multicultural population in the United States. Students in the global area of focus will learn things like social work around the world. What does it look like? How is social work practiced in other places, in different continents, in different countries? They will also learn about national organizations like UNICEF or the United Nations. What are they? How they work? What they do? They will learn about employment opportunities, volunteer opportunities, internships. And they will also learn about global issues in social work like human trafficking, child soldiers, children in and off the street, gender violence. It's a very expansive kind of area of focus that covers a lot and very interesting topics. So we have different classes in the area of focus. What we have is Global Practice 1 covers more of the perspective of global social work. That's where we look at employment opportunities, issues in global social work. Then Global Social Work Practice 2 focuses more on multicultural populations, so it's more like working with communities of immigrants and refugee populations. Then students have elective classes also, and they can take women's global health, they can take human trafficking, and they can also take experiences in social work in other countries, including Ghana, Mexico, and Mongolia.
So it's a 2-semester sequence, and in the fall what we do is trying to do basically an overview of health social work across the lifespan. So we would cover areas related to children and adolescents, addressing issues related, commonly occurring health issues that occur in that developmental time window. So issues related to maybe type 1 diabetes, cystic fibrosis, and other sort of health conditions that commonly do occur in the child and adolescent experience. We also then would cover issues that are commonly occurring in the adult window, so issues related to possibly cancer, other forms of diabetes, and then kind of moving through the lifespan, working with older adults. Where when we get into the older adult experience, healthcare and mental health are deeply combined, and most individuals with in this older age window have complex healthcare needs, and also then co-occurring with pretty complex mental health concerns as well. And so it's basically fall is this overview, and we try to look at the ways in which healthcare and social work intersect, and how social workers work in these settings. And then in the spring we do more of a deeper dive into specific models. And so the spring model really looking at now is what's called integrated behavioral health. So it's integrating social work into outpatient medical clinics and other healthcare settings. And so it's really looking at the ways in which social workers play an important role on a medical healthcare team, and how that role has become more and more integrated into the routine visits at a primary care doctor's office. The model really emphasizes the ability to have immediate and direct access. That we found that this is the best place to be able to actually access and address mental health concerns. So there's a little bit of a misnomer to think that a healthcare social worker is only dealing with health problems. Really, the healthcare social worker is looked at as the primary expert on mental health conditions, and those are being addressed in a healthcare setting. And so it's really a nice mix, and it's really an interesting new model to try and decrease the ways in which people fall through the cracks when it comes to the connections between their health and mental health needs and concerns. You also get an additional practice class outside of the concentration. Often individuals might take something in mental health as a good addition. The type of electives I think would be very valuable would be taking some specific therapeutic models that work very well in the healthcare setting. Motivational interviewing is a very valuable tool in the healthcare situation. Solution-focused therapy, which is brief, directed, and very kind of easily adapted into a healthcare model. Also, I think very important would be taking any sort of classes related to substance use, because that's another significant area in which social workers are called upon to address substance-related use needs in this healthcare setting. Something that we see consistently and extensively in like in an emergency room setting, but also very much so in the kind of general kind of primary care arena as well. So those would be really good ones. I also teach in the aging concentration, and so we do have a class that covers chronic health conditions and mental health conditions with older adults. So if somebody were particularly interested in health and aging, that might be an additional course that they could take as well.
Everybody in mental health takes 2 required classes. There's one in the fall called Mental Health Practice with Children and Adolescents, and then there's one in the spring, Mental Health Practice with Adults and Aging. So they're similar because we're looking at the DSM and assessment, intervention, engagement, and evaluation across the lifespan, but we take 2 semesters to do it. And then they get to take electives. We look at human beings as eco, bio, psychosocial, spiritual beings. So for starters, if you will, a holistic view of assessment and intervention. We look at all mental health practices being micro, meso, and macro. So in other words, you might work with an individual in the morning and be down at the Capitol, trying to change policy in the afternoon. And there may be combinations of those things in different instances. So there's that piece. We want social workers to learn the DSM good enough so that they can talk it, and advocate for their clients. So it's another important piece. We also especially challenge students to do self-reflection because a good mental health practitioner is an accurate mirror for their clients, and I can't really help you see yourself if I don't see my hidden biases. So we look at, the biases we have about pretty much everything, and there's an emphasis on cultural diversity and ethnic diversity and all the differences that tend to divide human beings, and talk about that in all our case examples. So that's a big deal as well. And since the classes are arranged by age, we look at differences across the lifespan. Always also we look at things in the context of family and community.
So in the addiction area focus, there's 2 practice classes, practice 1 and 2. Practice 1 is very focused on assessment and understanding what's called the ASAM criteria, which is a national protocol on assessing addiction issues. Practice 2 incorporates an extended understanding of ASAM as well as understanding the organizations and agencies that serve different treatment components here in the Utah area. Then we have the students take a class in understanding the biochemistry of addiction. So they understand medication, medically assisted treatment, and how that works within the brain functioning. And then we encourage students to take electives in understanding cognitive behavioral therapy, motivational interviewing, solution-focused therapy, mindfulness therapy, trauma-informed therapy. Any of those electives are going to be excellent complements to the substance abuse area focus. I believe a student who leaves that area of focus once they graduate will have a very concrete understanding of the treatment protocols involved in working with people struggling with addiction. And not only understanding the treatment components, but as a social worker, understanding the intersection of practice as well as macro practice, meaning there are systems, governments, laws in place that sometimes help in the treatment of addiction as well as become barriers. And so I have found as a social worker in practice that I have to understand the clinical skills as well as how to navigate the system. So anyone who participates in this area of focus is going to have a solid understanding of treatment protocol, treatment approaches, as well as understanding how to navigate the system. And not only just from a local perspective, but even understanding the national implications.
Probably the most common ones would be like in a hospital setting, a geriatric hospital setting. Could also be a residential treatment center, so substance or behavioral issues, things like that. Our students get extensive training and then they actually engage in what I guess we could best define as a community-based geriatric health paradigm. So students in this particular placement, they're typically assigned about 6 clients as a caseload, and so these are all adults age 65 and older, and they will actually go visit their clients in their homes at least once a week. And so part of that is an ongoing check-in, but we also have students kind of do like an every other week continuously in-depth assessment across all of these domains. And so if there's any risk factors, any triggers, any warnings or anything, students are trained to intervene with themselves as they're able, but they are also able to refer clients to other resources, and then if there's a seriously, potentially dangerous situation, then they also have training on how to deal with that.
Obviously, if someone is choosing the child welfare concentration and they're not an employee of DCFS agency, they are encouraged to be able to, they're encouraged to prepare for a practicum with them. And we have, we have a program here that helps supports them in their education if they are thinking they want to make a career in child welfare with the agency, where they can have some support for the cost of their education here in exchange for employment period with the agency. Beyond that, though, we have numerous cohorts who are already employed at DCFS whose practicum placements are all across, they spread the gamut, much like I suggested, of these issues that intersect with the child welfare system, the mental health, the substance abuse, the health and aging and domestic violence and immigrant and minority populations. All of these are practicum type placements that could only serve them, increase their skill in serving the child welfare families better.
You would of course take a practicum that puts you in a forensic or criminal justice involved setting. I think what's unique about that compared to other areas of social work is that you are very much having to negotiate the criminal justice system over which you have very little control, and then helping your clients kind of respond to what's going on in their life, but also respond to the criminal justice system, which can feel like its own external pressure. That would maybe be in a secure care juvenile justice facility, or a community-based, say, youth on probation or diversion in the juvenile system. In the state of Utah, they try to keep kids out of the juvenile justice system as much as possible, in acknowledgement that the more you pull people into the system, the more you increase the chances that they'll commit future offenses. And then for adults, again, you would be in maybe community mental health settings, a probation parole agency, a prison, a jail. I don't believe that we have any placements in private probation agencies, but as a professional, you would maybe work in, say, a private probation agency as well.
The practicum placements are varied. They can be either in schools or social service community agencies. Any place where there are services to immigrants and refugees that cover either mental health, and even the process of resettlement. So very varied type of placements. International placements are also optional. They need to be arranged.
So there are practicums where a student may be working with a variety of different types of cancer, let's say. And that would be an expertise. So if a social worker were practicing post-graduation, and kind of the experience that I had in my work, the tendency is to become much more specialized in a specific area of health. Cancer might be an option, working in a cancer clinic. There are several hospital-based practicum that a student could participate in that, and usually with a larger hospital setting, the student has a chance to move between different units or areas in the hospital to get a varied clinical experience. There are practicum related to working with veterans in healthcare setting. There are some, again, more specific related to the work that I do. So in a neurology setting where you've got working with specialized neurologic interventions. But there are women's health, there are refugee related healthcare options. So there's really a nice mix of choices once you kind of select health as your concentration.
there's very many. It's hard to think of an agency that doesn't address mental health a little bit. Some are more fundamentally mental health, like UNI, which everybody thinks of as an inpatient unit. But there's also very many outpatient, and a lot of our students practice in locations where there's so-called dual diagnosis, where there's addiction issues as well as mental health. So there's actually it's quite a vast number of selections, and students usually have a number of choices.
The reality is issues of addiction impact most agencies in this valley. And so what I've noticed is the University of Utah has a rather complete list of organizations and agencies, from outpatient, intensive outpatient treatment programs, residential programs, working with all age groups, from geriatrics to children who are dealing with addiction issues in the family. And so I think we have a pretty eclectic list of practicum placements. And what I think is interesting, and that most students need to understand, there is an incredible shortage of qualified social workers to address addiction issues in the Valley. So there's a ton of jobs out there, and so most of these practicum organizations, if you will, the practicum kind of becomes the audition for future employment. And because the community of addiction treatment is so, it's a professional group of people that know each other. Let's say I had a student at my practicum and they were doing really well, but I couldn't hire them. I would know people who were hiring. And so I see a lot of students actually complete the program and become employed pretty quickly.
Unless you're a really, really, really bad person, you have a guaranteed job for the next 60 years. So there's two things going on with this. So one is what we call the aging of the population. So beginning January 1st, 2011, and continuing every day until December 31st of, I think it's 2030, 10,000 baby boomers will turn 65 every single day. So you multiply 365 by 10,000, and then multiply that by 10. Within the next couple of decades, the 1 in every 5 Americans will be 65 years old and older. There's an increasing need, and of course, like everything else, it's supply and demand is part of it, but there's already a critical need for gerontological and geriatric social workers, and with this continuing aging population, the older population itself is getting bigger, there's going to be an increasing need. So if you want job security, aging is where it's at.
Given the recent news that apparently social work is the fastest growing profession in the world, and the fact that we're getting better at identifying individual and family needs, knowing where maybe even just a couple decades ago we weren't very good at assessing for or identifying the needs and addressing them adequately, there is plenty to do. If you want a job in child welfare, pretty much you'll be able to have the job. In fact, recently there was several hirings in different entities, and they're just not enough. There's more vacancies than we can fill, which is great. It's great job security. So I'm just saying, even for advancement, we're just not talking frontline casework, but because of this need, those that have a passion and show it, they quickly become the supervisors and administrators within the child welfare system.
Agencies that hire forensic social workers cannot hire as many people as they want. So I would say there is tons of room for people who want to do micro practice, so working individually with consumers. There is also a lot of need. So our stakeholders at the Utah Criminal Justice Center are the heads of agencies like corrections, juvenile justice, and they are always looking for researchers as well. So I think in terms of the macro practice, there's also a lot of opportunity for folks who are really interested in data, research, evidence-based practice, and also that sort of meso practice level where you think about how do you take evidence-based practice and implement it organizationally.
Social workers with global expertise have many opportunities for work. It expands their marketability. We live in a global world. It would be very difficult to go to any agency, even in Salt Lake City, and not finding people from other countries. We are very interdependent these days, and so there are many, right now the market for social workers is very good, and this expands their marketability because they will be really the leaders of supporting people to navigate the challenges of this global world that we live in. Not only people and organizations, but even it could be countries.
So really there is a significant growth in the healthcare setting for social workers. There's an expectation, a need for like 35 to 40,000 more social workers in healthcare settings. It's also on average, the annual salaries of individuals working in healthcare settings is approximately $10,000 more than other common settings where social workers might work. And I think really this is the growth area. Working with older adults is a significant growth area because we have this expanding aging population in our society. And always there's going to be healthcare needs with them as well. And so I think that this is kind of looked at as sort of where a lot of the new opportunities are in sort of this, again, particularly the new integrated behavioral health model.
So unfortunately, there's going to be lots of room for mental health work, and it's really interrelated with everything else social workers do. I mean, I really can't think of an area where mental health doesn't need to be addressed or considered when you're talking about really anything,
Social workers with this expertise are going to find a job pretty easily. About 2 years ago, an organization came to this college and indicated that they had 36 openings for social workers. And the reason they had so many openings, they had plenty of social workers applying for jobs, but they didn't have any that were qualified. And so, they came to our organization saying, what we really need is for you to train and create qualified social workers when they graduate. So this area of focus has been a collaboration with those organizations. And so I think that when students complete this area of focus, when they show up for those interviews, they show up as qualified and capable.
Aging is sexy. Aging is the new sexy. I never intended to go into aging, and somehow I fell into it, and I couldn't have made better choices. And so if you care about people, if you care about social justice, aging area of focus is for you.
I would say this whether or not I was here in Utah. I have worked for the Children's Bureau for a while back east in Virginia and DC. And I can tell you that Utah's model is one of the best in the nation. And I say that because that's what they say. And in fact, they've referred to the way we not only conduct our child welfare service system, but how we evaluate our own practice as a Cadillac of models. And what that means is that it's no surprise to me that when someone gets their education here in Utah in the child welfare system, I have yet to have anybody who I know of that's gone out of the state struggle finding a job. They are picked up rather quickly. They know, particularly, that if they know a child welfare system in any state, much less Utah, that they're going to be familiar not only with issues that one typically thinks of that are common within the clients of the child welfare system, but the other issues that are usually intersecting with the needs of these families, from mental health to substance abuse to health and aging and domestic violence. All of these services are common, or all of these needs are common within the client base of the child welfare system. So that makes them pretty marketable.
Whether or not students specialize in the forensic area, I think you are almost always, as a social worker, going to be working with people who are involved in the criminal justice system. So whether that's in the mental health domain, the child welfare, the substance abuse, like all of those domains tend to also pull folks who are involved in the criminal justice system. We do a lot of work here at UCJC looking at the intersection of homelessness and criminal justice, serious mental illness and criminal justice, and substance abuse and criminal justice. So I think it's a great domain to kind of give you contact with a bunch of different service areas that social workers work with. So it, to my mind, can I say it's the best one?
It's very good. It's an excellent. Students really enjoy it because I think it opens their minds to things that are different in many ways to what we do, but also so similar because we're still human. So we connect, but in many different ways. So it's pretty cool. That's what I say.
I think it's just an exciting opportunity. It's probably the best opportunity to work as a part of a interprofessional team, which is, I think, a wonderful arena to work in. And then it's an opportunity to utilize and be viewed as a valuable team member in utilizing your mental health and substance use related skills in a sort of a broadly defined healthcare setting. So I think it's really, the opportunities abound and it's an exciting place to work.
Health is an important goal and issue and challenge locally and globally, and will continue to be. The World Health Organization called depression the #1 health problem in the world, not AIDS, not malaria, not the kind of diseases associated with poor air, water, which suggests that people all over the world are suffering from, and usually depression and anxiety are associated together. It's a big deal.
I think with all the areas of focus, students show up the second year well versed in mental health issues. And I think that what the area of focus allows students to do is to diversify their resume by showing that they have an area of focus in addiction issues, gerontology issues, health issues. So these area of focuses are a great opportunity for social workers to graduate with a level of diversity built into their resume. Master's of Social Work says I'm equipped to do mental health. The area of focus says, and I've also concentrated some focus here. That would make them qualified. I think students are often afraid that the area of focus somehow pigeonholes them. And I can give my personal example. I focused on forensics, correctional social work, but I've worked in child welfare, I've worked in correctional systems, I've had a thriving private practice. When people are looking to hire, the first thing we want to see is the MSW.
Hi, I'm Elizabeth Perez, Director of Academic Advising here at the College of Social Work. You've learned a little bit about our 7 areas of focus, and I want to talk to you about the timeline for selecting an area of focus and some frequently asked questions that students have, and then where you can go if you have additional questions afterward. So first of all, students work on their area of focus in their second year of their MSW program. So they usually select their area of focus the winter prior. So for example, if someone is in the 2-year Master of Social Work program, they're going to go through the first half of that first year, and then in January of that first year, they're going to have an area of focus meeting, have opportunities to meet with their academic advisor and begin that selection process and complete that declaration. For an advanced standing student who only has a 1-year MSW program, they're going to select their area of focus really prior to starting the MSW program so that they can jump right in and begin working on that in that 1-year program. Students often worry about whether they're going to select the wrong area of focus. Maybe they have multiple interests, or they don't know down the line if they'll still be interested in child welfare in 10 years, or if they'll still be interested in global social work, etc. So there's a lot of anxiety around, what if I choose wrong? I have these 7 options, they all sound great. Am I going to be limited to one area of social work if I choose X, Y, or Z? And the answer is no. Really, the area of focus is an opportunity for you to be able to hone your skills in a particular area, have a signature experience at the U that means something to you, where you feel empowered to take elective classes and complete a practicum in a sector of social work that matters to you. But it by no means dictates your career opportunities in the future or limits you in any regard. So students are asked to choose just one area of focus. They don't choose multiple ones, although certainly they can layer a graduate certificate or some additional electives with that. Another question that people get asked, or people ask advisors and their professors about areas of focus is, does choosing one area of focus limit my ability to take other electives in a different area of focus? So all students are asked to take at least one practice class outside of their area of focus, so that helps them diversify a little bit. And then students do have some flexibility to take some additional electives. The best way to really formulate this plan is to meet with an academic advisor who can work with you on what your interests and needs are and develop a program of study that fits your goals and your desires. If you have additional questions after this video, that's what academic advising is here for. You're more than welcome to set up an academic advising appointment. You can do that by visiting socialwork.utah.edu/advising, and you can meet with an MSW advisor for more information. You're also welcome to meet with faculty members who share the areas of focus during their office hours. Thank you.